Hello?
Hi, Miss Jameson. This is Damon. Can you hear me?
Hey, Damien, I can hear you great. I should be there in about 5 minutes.
Perfect. We'll let the chair know. Thank you. Dr. Jameson said she'll be here in about 5 minutes.
Can you hear us in Carson?
We can hear you just fine.
Okay. Looks like we'll have to wait in order to have a quorum. So.
She's still on the phone, I believe.
Is she?
Dr. Jameson, you're still on the phone, correct?
I'm on the phone.
Okay. Then why don't we go ahead and get started?
Except there were 2 other people on the phone.
Pardon?
Oh, I just said it said there were 2 other people on the phone.
All right. We were just trying to make sure that we had board members in order to have a quorum. So I'll go ahead and open the meeting. Well, let me wait a couple more minutes. It's not quite 1:30.
Some of the people who live on the street. So much for the car teams. This is Jackie Jackson's, Michael Jackson's oldest brother. And they're trying to take away the zoning for a 1 acre parcel, high-end houses, and make it into a subdivision.
Anchoring this.
Yeah, these are the people that are going to the meeting tomorrow. That's Henderson. Oh, you have what?
We have a real estate reporter.
Oh, do you? Yeah, it's planning commission.
Okay.
And it'd be worthwhile I'm going to, that's for sure.
Okay. All of them.
All right. Dr. Jameson, can you still hear us?
I can hear you really clear.
All right, great. We'll go ahead and start the meeting. This is Leslie Johnstone, and this is the Silver State Health Insurance Exchange Board meeting. I will call the meeting to order, and do we have any announcements?
None in Carson City.
Okay, thank you. Mr. Director, could I get you to go ahead and call roll?
You can, thank you very much. Madam Chair Johnstone.
Here.
Vice Chair Kerr.
Here.
Ms. Lewis.
Here.
Dr. Jameson.
Here.
Dr. Ford. Mr. Whitley. Commissioner Kipper. Here. And Mr. Wells. We have a quorum, Madam Chair.
Thank you very much. Do we have any public comment in Henderson? Thank Thank you. Do we have any public comment in Carson City?
None.
Thank you. With that, we'll move on to the next item, which is approval of the minutes of the March 12th, 2015 board meeting. Do any board members have questions or corrections? If not, is there a motion to approve?
Motion to
Dr.
approve.
Jameson, I make a motion to approve.
Lamont Lewis, second the motion.
Thank you. We have a motion and a second. All those in favor say aye.
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 Opposed? Great. There's approved. The next item is the executive director's report.
Thank you, Bruce Gilbert, for the record. We've been pretty busy the last couple of weeks, to be frank with you. As we reported at our last meeting, we've turned our attention to and we're moving forward on a number of different projects that we feel are critical to the future of the exchange and also offer the opportunity to bring closure to the past. We continue our work with CMS and SSHIX to develop a sustainability plan that recognizes both the contributions of the exchange and those of our federal partners and will ensure our continued success. A group of our staff members, along with the board's vice chair, traveled to Bethesda, Maryland to meet with senior leadership of CMS and SSHIX last week to discuss sustainability and associated concerns. It was a good discussion. It was in many ways a frank discussion. I think everybody came away from there with a pretty strong understanding of the value of having a state exchange and the value that our federal partners bring as well. No numbers were discussed. I can't say that we know exactly what the expectation is as far as sustainability going forward, but it was definitely a good discussion, and the vice chair is welcome to comment on that if she wishes.
I think you covered that pretty well. Thank you.
Bruce. We continue to monitor state and federal legislation to identify areas of concern. We'll be covering more of that in the course of the legislative update later in the meeting. We have already begun our transition for plan management and certification away from the Division of Insurance and moving it over to exchange staff. Training is underway. I had the opportunity to meet with Commissioner Kipper and the folks over at the Division of Insurance earlier today, and everybody is very comfortable with the progress that is being made, and everyone fully anticipates our being able to internalize those responsibilities within the timeline that's been required. We've completed the initial review, if you will, of the Exchange's website, not the HealthLink website, but in fact our governmental website, both in terms of content and appearance. If you'll recall, we discussed this at our last meeting. There are a number of documents on there that really no longer are required and some other things that I think could be cleaned up. The new look and format is going to reflect a design which is consumer-centric and will include changes based on our prior focus group guidance as it was applied to the Nevada HealthLink site. We expect this to be ready sometime late this summer, so we should have something to look at in the next meeting or so. Our Consumer Assistance Center is fully equipped. Staff training has already begun. Rosa is up here working with folks as we speak, and we are or appear to be fully prepared for the changeover tomorrow and taking over those duties from the Xerox call center. On a happy note, our council has successfully negotiated the dismissal of the exchange from the 2 class action lawsuits that had been filed previously. The dismissal is without prejudice, meaning that they have retained the right to bring the exchange back into the litigation if deemed necessary, but at least for the moment, we are no longer being sued by our agents and consumers, which is a very good thing indeed. We are negotiating with respondents to our recent Navigator RFA with the expectation that those discussions will be concluded within the next 2 weeks, and we'll be presenting the contract with our chosen marketing firm to the Board of Examiners for approval in May. We've met with the Internal Revenue Service to discuss the issue of required retention and purging of federal tax information and the problems which are posed by the architecture of the Xerox system. We'll discuss that in greater detail later in the meeting. There will be additional discussions involving the exchange and various federal agencies as we continue to move through this issue. And in fact, there is a teleconference scheduled for tomorrow involving Xerox, the IRS, CMS, and the exchange. We've also maintained our dialogue with both Xerox and our carrier partners with respect to the reconciliation process. And we continue to attempt to address the concerns of both the carriers and our consumers as we press forward. As I indicate in the conclusion of my report, I had sort of expected that things would calm down once open enrollment concluded, and that is clearly not the case. We have a lot of issues outstanding. We have a number of things that need attended to that we need to work through in anticipation of the next open enrollment period and the additional functionality that we will be taking on. Overall, though, the exchange is doing well, and I'm generally pleased with where we are at this point in time. And that would be the sum and substance of my remarks.
Thank you. Any questions from board members? Mr. Gilbert, I did have a question. Go ahead, Dr. Jameson.
Congratulations on being ready for the switch over to our call center tomorrow. And when you were talking about, you might go into this in the meeting a little bit later, but are we going to have the specialist to help us with the IRS issues?
This is Bruce Gilbert for the record. Tomorrow's discussion, I think, is sort of critical and important. We're basically dealing with experts in terms of dealing with the IRS itself, as well as CMS. We're looking for guidance, if you will, and our expectation is that the federal agencies will provide that guidance tomorrow.
Very good.
Thank you.
And Mr. Gilbert, I had a question about the transitioning the plan management and certification from Division of Insurance to the exchange. I must have missed it. I don't remember the genesis of this decision. Can you give a little background?
I can indeed. Thank you, Bruce Gilbert, for the record. As you may recall, CMS changed a number of timelines with respect to the 2016 plan year open enrollment. And as a result of those changes, the workload and the ability of our friends at the Division of Insurance made it difficult for them to be able to provide these services on an ongoing basis. As a result of discussions between our staff and Commissioner Kipper, we came up with a transition plan, if you will, which would allow the exchange to take over these particular responsibilities. The individuals that they had previously used, when I say they, meaning the Division of Insurance, to provide these services were no longer available, and there was some concern as to whether they would be able to help us meet the timeline. And so a determination was reached that we would be able to take over those particular responsibilities. Commissioner Kipper, is there something you would like to add?
No, for the record, Scott Kipper, and I think, Bruce, you've laid it out pretty well, that just the time and resource issue, it was a mutually agreed upon, mutually discussed, and was not an overnight decision, but whether one that we had discussed over some time, and we're very comfortable with assisting in the handoff, and I certainly make our staff available even more if necessary going forward.
Thank you. Bruce Gilbert for the record. One other thing, the DOI retains rate review. That is not something that we are doing internally. We're dealing specifically with plan management and certification, which is something separate. It involves filling out templates and is really, I don't want to call it clerical because that doesn't do it justice, but it is a less technical aspect of the plan management and certification process than, for example, rate review.
Thank you. What is the impact on the carriers? Do they now have to split what they send to DOI versus the exchange, or what's their impact?
Again, Bruce Gilbert for the record, there is no impact. They don't split anything. We work with them directly to get the information that we need, and we review the template. So they work directly with us. There's no impact to them.
Okay, and then my last question, I guess, is plans that are offered on the exchange must also be offered off of the exchange. Do they have to, what is the scope that the exchange is taking on? All of that or just those that are on the exchange?
For the record, Bruce Gilbert, we're only dealing with those plans that are on exchange. We do not deal with the plans that are off exchange.
Okay. All right, thank you. The next item then is number 5, the enrollment update.
Thank you, Carrie Eaton for the record. The exchange experienced a successful open enrollment period that ended on February 15, 2015. For those who were unaware or didn't understand the implications of the fee for not enrolling in coverage, CMS is providing consumers with an opportunity to purchase health insurance coverage from March 15th to April 30th. If consumers do not purchase coverage for 2015 during the special enrollment period, they may have to pay a fee when they file their 2015 income taxes. At this time, there is no indication that an additional special enrollment period will be offered by CMS. I will turn it over to Mr. Klimas briefly if he has anything to add about the special enrollment period.
Thanks, Carrie. Tyler for the record. The tax season special enrollment period ends, of course, in 2 weeks. We've had weekly calls with our navigator organizations. They're reporting upwards of 15, 20 calls a day regarding this, which I think is solid traffic. They've received a combined between CARE and the Ramirez Group over are close to 60 in-person applications in their offices, which I also think is great news for this period. And CMS released data as of March 29th, about 36,000 consumers have selected plans in this tax season special enrollment period. That's out of the 37 states utilizing healthcare.gov. So I just wanted to give a quick update. I think this is pretty much exactly what we expected. Again, another opportunity for consumers to sign up for health insurance. So I think all good news on the SEP front. Thanks.
Carrie Eaton for the record again. The most recent reports submitted to the exchange were on March 20th from the carriers that showed all effectuated enrollments. These reports show fewer April effectuations, as you can see on page 2, than March, which can be caused by a number of reasons, including terminations due to non-payment and a 30 to 60-day reporting lag due to payment due dates that do not correspond with the exchange's reporting deadline. The exchange utilized conservative projections for our budget building over the next biennium, the 39,000. And right now we're averaging 49,523 per month in 2015 is great news because we're over our projections so far. The Department of Health and Human Services Office of the Assistant Secretary for Planning and Evaluation released an enrollment report for the period of November 15th through February 22nd, which is the plan year 2015 open enrollment. The ASPE reported the total number of plan selections with financial assistance data for Nevada. The total number of plan selections was reported as 73,596. 89% of those individuals qualified for financial assistance. Of that 89%, 55% qualified for cost sharing reductions and 89% qualified for advanced premium tax credits. The ASPE reported the total number of plan selections by age for Nevada. 37% of applications were for individuals from birth to 34 years. 30% of applications were for individuals from 35 to 54 years, and 27% of applications were for individuals over 55 years old. The ASPE reported the average monthly premium of total number of plan selections for Nevada. The average monthly premium of all plans selected is reported to be $361. The average monthly APTC of those plans is $242. So the individuals who qualified for APTC saw an average premium of $119 per month, which is a 67% reduction of premium due to the APTC. So the exchange's average enrollment is already over conservative projections of 39,000 individuals. Of the 73,596 selected plans in Nevada, almost 60,000 have paid. Nevadans clearly are willing to enroll their families in health insurance and have found Nevada HealthLink as an effective channel in 2015. Thank you.
Thank you, Ms. Eaton. Any questions from board members?
I apologize. I'm Florence Jameson for the record. Just confused about the qualified health plan effectiveness to date at 49,000 and your statement now of 60,000.
This is Bruce Gilbert for the record. Dr. Jameson, the difference between those numbers is one is the high point, which is where we are now, an estimated 60,000 enrollees which have been effectuated. The 49,000 and change, or roughly 50,000, is a monthly average, which allows us to do our budgeting. So that's the difference between the two of them. Over the course of the 4 months, I think it is, January, February, March, and April, if you look at those 4 months, we've had 49,000 if you spread it out over the months as the average enrollment number. Was that helpful, I hope?
Yes, it is helpful.
Ms. Eaton, I had a question. Do we have any expectation that the federal reporting from the ASPE will transition to paid enrollees as opposed to enrolled?
Thank you, Carrie Eaton, for the record. No, we do not anticipate that they will transition to paid enrollments. We get our paid enrollments straight from the carriers. CMS and ASPE do not report those.
So do we think we're going to continually have this difference? I mean, there's obviously more detail that's being provided on the enrollment figure. Is it possible at all to get that from the carrier so we only have to report one set of numbers?
Yeah, this is Bruce Gilbert for the record. I think that we're looking at two different numbers, but they're not intended to mean the same thing. The 73,500 and change simply indicates the number of individuals that we were able to touch through our outreach to educate and get to come onto the platform and make a plan selection. It's nothing more than an indication that our marketing was successful. With respect to the number of effectuated enrollments, that's the number of people who have been able to actually pay for their insurance and have paid for their insurance, and their insurance has gone, their coverage has become effective. So you're looking at two different numbers, but they're really meant to signify two different things, if you will, I think.
I appreciate that. I just would be curious if we would be able to get the level of detail or something close to that for the actual policies that are outstanding. It might serve one of the purposes of marketing to find out who thought they were going to enroll and then in the end decided not to figure out if there's a strategy to catch that gap.
Again, Bruce Gilbert for the record. Your comments are well received. We recognize and understand that it's important to fully understand our market, and that is who we've been able to reach out to and who we have not, that might fall into our target population. Unfortunately, the information that we are receiving from the federal government, I believe, is the only information that is available. We can certainly reach out to the carriers and see if they can augment that, but there wouldn't be any additional reporting available through CMS.
Okay, thank you. All right, next item is number 6, which is the legislative update. Yes.
Madam Chair, I believe Commissioner Kipper had a statement.
Yeah, for the record, Scott Kipper, and I think you've answered this enough for my understanding, but just to understand the effectuations on this chart are the number of, and I don't want to I use this term kind of roughly, but enrollees who have paid in the April effectuation. So we have roughly 58,400 who have signed up and paid. the number of people who have visited the website and selected a plan is roughly 73,600. And then those, we've got 73,400 who we've got age data on. Is that?
That would be correct. Basically, everybody who has gone through the enrollment and application process, whether or not they have paid, their age statistics are in fact captured and calculated.
Okay. Thank you.
Thank you. Thank you, Madam Chair.
Thank you. All right. The next item is the legislative update. Mr. Gilbert.
Thank you. Bruce Gilbert for the record. Legislature's in session. It's been a pretty interesting time. The legislative update covers 5 pieces of legislation that apply to the exchange and its activities. The first is Assembly Bill 86, which was filed on behalf of the governor. We discussed this previously at our last meeting, and the board instructed me to contact the governor's office and determine whether they might be amenable to removing the first section of the bill, which removes the words state-based from our statute. I did, in fact, reach out to them. I have not received a response to this point in time. It might be possible for us to file an amendment, if the board feels strongly, to request that section not be changed. But I have not had anything further come back with respect to that particular piece of legislation. Section 130, Senate Bill 137, which we also discussed at the last meeting, would have prohibited the sale or purchase of qualified health plans with embedded pediatric dental plans on the exchange. The section which dealt with the exchange, Section 3 of that bill, was deleted in committee and did not go forward. So the bill itself has moved forward, but Section 3 has not.
Mr. Gilbert,
yes.
As you go through these, could you help us with what the current status of the bill is, how far through the committee process, et cetera?
I can. With respect to Assembly Bill 86, that was amend and due pass, so it currently awaits hearing, I believe, on the floor of the Assembly. With respect to Senate Bill 137, again, that was an amend and due pass, and that awaits further action in the Senate at this time. The third piece of legislation is Assembly Bill 368, as introduced by Assemblyman Jones. We discussed this in its BDR format at our last meeting. The intent was to repeal those portions of the Nevada Code, Nevada Revised Statute, that provided for the creation and existence of the Silver State Health Insurance Exchange. I testified against that along with some other folks. The commissioner was kind enough to have put in a fiscal note on that bill as well. I would also mention specifically that Barry Gold appeared and testified on our behalf in the course of the committee hearing, and he did an outstanding job, and I would publicly thank him for the testimony that he provided. Assembly Bill 368 died in committee. It's done. It's gone, and it won't be resurrected. The same is true with regard to Senate Joint Resolution 14, as introduced by Senator Gustafson. This was intended to create a constitutional amendment which would prohibit the operation of an exchange in the state of Nevada. Testimony, I testified against that, as did Keith Lee on behalf of the Nevada Association of Health Underwriters, and Andres Ramirez as well. And again, I am pleased to say that this bill died in committee and is not moving forward. Assembly Bill 355 is the final piece of legislation we'll discuss. It's intended to provide changes to the Nevada Administration Procedure Act, specifically with respect to rulemaking by various agencies and boards. Currently, and I think that Mr. Bocourt has indicated this to you previously, there are a number of aspects of the Nevada Administrative Procedure Act to which we are not required to comply. This bill would roll that back and require that we comply with all of the obligations under the Nevada Administrative Procedure Act. And basically what that would do is it would significantly slow our ability with respect to rulemaking. Pretty straightforward stuff. I sent a letter outlining our concerns to the bill sponsor and the members of the Assembly Government Affairs Committee. This bill no action was taken, but it was re-referred to the Assembly Committee on Ways and Means, where it resides at present. No hearing date has been set.
Thank you. Any questions from the board members? Just a request, Mr. Gilbert, the letter that you sent regarding Assembly Bill 355, if you could copy the board members when something like that goes out. And to catch us up, if you could send us what you gave the committee.
Yeah, Bruce Gilbert, for the record, I'm happy to do that. Not a problem.
I just wanted to go back to prior to the legislative report. I just wondered what the relevance was on reporting on the 70,000+ versus not just reporting on the actual number.
This is Bruce Gilbert, for the record. That's the number that we were provided by CMS, and it's historically the number, at least early on in the process, Dr. Jameson, that we've been judged on. We know that approximately 39,000 people last year went through the enrollment process. They did not all become effectuated. And so it's a yardstick. Again, it measures to some degree how successful we were in terms of our outreach, marketing, and education. And it gives us some understanding with respect to what we can anticipate effectuated enrollment to be. Generally speaking, there's probably a 10 to 15% difference between those two numbers. But it's a yardstick for outreach, education, and associated activities. Yeah.
And I can understand knowing that number, like 73,000. So then you have your yardstick, but then probably I don't understand the purpose, but we can leave it at that, at breaking down any more than the actual ones that purchased. But I understand what you're saying.
All right, thank you. Let's go on to item number 7, which is the Navigator RFA update.
Thank you. Carrie Eaton for the record. The Exchange published the Navigator entity request for applications on January 23rd. 11 entities submitted applications by the February 25th deadline. Of these 11 entities who submitted applications, 1 entity withdrew their application and 1 entity did not meet the requirements of the RFA. All applications were reviewed by a team of staff members and unanimously agreed to negotiate with those remaining 9 entities. Prior to negotiations, the Exchange would attempt to subgrant with as many qualified entities as possible to leverage current relationships statewide. The Exchange would attempt to award subgrants that include the same, at minimum, or more navigators as was previously awarded in the last grant cycle, and the Exchange would attempt to ensure navigator representation was statewide and that the ratio of navigators was close to the population ratios north and south, which is approximately 75% south, 25% north, as possible. And the Exchange would award subgrants with budgets totaling at or below the fiscal year 16-17 governor's recommended budget to ensure exchange sustainability. Staff is proposing to award entities that staff 28 navigators during non-open enrollment. And I do want to note that the table on page 2 does have a typo on the column on the total right side. It says 32, and that number should be 28 for the total. During the last grant cycle, the non-open enrollment period maxed out with a total of 42 navigators. However, the number of navigators available during any month fluctuated last cycle. By reducing the number of navigators available during non-open enrollment, the Exchange can focus in-person assistance during open enrollment when Nevadas need assistance the most. Additionally, staff is proposing to award entities that staff 56 navigators during the open enrollment period. This mirrors the highest level of navigators available during the last cycle. Staff is currently negotiating with 9 Navigator entities in addition to the 1 Navigator entity to support the Exchange Consumer Assistance Center. These awards will more than triple the number of Navigator entities that the Exchange will partner with. The Exchange is looking forward to utilizing these entities and their large number of community partners to provide Nevadans the greatest level of assistance. Exchange staff is still in the final negotiation process with the 9 qualified entities who applied. There are exchange requests to increase and/or decrease the submitted request to meet the requirements of a comprehensive statewide Navigator program. The Exchange anticipates these negotiations will complete the week of April 20th through 25th, with awards going out April 28th for a May 1st start date. I would be happy to answer any questions.
Thank you. Any questions from the board members? I would have one, Ms. Eaton. Excuse me. I appreciate the comparison between the last cycle and this upcoming cycle. How do we evaluate, or how have we evaluated, if the numbers that we had in the last cycle were correct, a little bit more than we needed, not enough?
This is Damon Haycock. For the record, Madam Chair, I think part of the concern was to determine a benchmark on that last cycle is difficult with no additional information from the first cycle, seeing how the system itself had so many issues through the Xerox portal that we couldn't benchmark from one open enrollment period to the next. But what we have been able to do successfully is through Navigator reporting determine what type of impact that those navigators have had, as well as the non-quantitative impact but more qualitative impact of our open enrollment stores, where navigators and producers worked hand in hand to enroll Nevadans, as I'm sure you've heard multiple reports on over the last cycle. So unfortunately, we're still in a benchmark building process to understand if what we have submitted is the appropriate amount. But we have basically been following the original board guidance on what type of budget and what the Consumer Assistance Advisory Committee recommended was the right thing to do for 2015. And we've taken those numbers and that information to build out exactly what we were going to present to the board as far as this Navigator RFA process. I hope that answers your question.
It does. I'm curious now what the plan is on how to build that benchmark.
Damon Haycock, for the record, the first thing we have to do, of course, is collect all the data from this open enrollment period and use that as a basis. How much we spent on the navigators, how many folks not only were enrolled, but how much outreach actually occurred. Because as we all know, navigators have multiple roles. They're not simply in-person assisters, but they perform that critical outreach and education function. And so that's a little bit more difficult. However, we do receive reports every month from our navigator entities to date, and we fully anticipate to receive those reports with the new navigator entities starting in May on not only enrollments in their areas, but as well as the outreach itself. And from that, we can build, for lack of better terms, a table or a matrix to determine, trends and highs and lows as far as our ability to successfully provide that outreach. And then even further, you can tie a dollar figure to it.
Dr. Jameson?
Since we don't have any quantitative data, do we have any kind of qualitative feedback at this point from the navigators that were on the field, whether it was out from the field or in our stores, as to whether they felt we were short navigators or it was just about right, or we had way more than we needed for the people coming in?
Dr. Jameson, this is Tyler Klimas, for the record. I think you can hear me. I mean, as far as that goes, we never had any response that, we were short on navigators. As you know, the navigators worked hand in hand with our agent and broker community, not only to staff the enrollment stores, but as well as the enrollment events. So, I mean, it's tough to put any kind of dollar figure on that. We know they played an integral role. It was extremely important. From my perspective, from marketing and consumer outreach, it was invaluable to have them. So I guess it's the best I can do for you. If you'd like any follow-ups, or if you have any follow-ups.
For the record, Damon Haycock, I want to dovetail a little bit off of what Tyler said. One of the things that I think we can count on is the fact that if Nevada HealthLink did not do something appropriately, we would have heard about it. And so I don't believe we've had any reports or responses that we have failed to provide adequate or appropriate in-person assistance. Not to say that that's the end-all be-all, but I think we can believe in the guidance that was provided by the advisory committee, the budget that we were able to sustain this year with our Navigator program, and the idea of attempting to at least keep the same level of effort out into the field, as well as to spread out those organizations into multiple populations that we may not have had a window into in the first year. I think after this next open enrollment, that you will all see a little more insight as to how effective our Navigator program really is.
Yeah, as one board member, I think that's very important because we can't forget that the cost of the Navigators is being passed on to the consumer. So we need to go through a due diligence process to make sure that we're using those dollars effectively. All right, we'll move on to the next item, which is number 8, advisory committee recommendations requiring review.
So this is Damon Haycock for the record. This advisory committee recommendation report is going to be one of a series of reports that we'll be bringing to the board over the next coming months to try to take this in chunks and not overwhelm everybody with going over the entirety of all the advisory committee recommendations. And if you all remember, of course, last May, the decision to transition to the supported state-based marketplace model was approved. And with that, there was a comparison that was developed that discussed the differences between healthcare.gov and the system as it was supposed to have been designed by Xerox. And therefore, the policy decisions that went into that system design may or may not still be valid compatibility-wise with healthcare.gov. And so throughout that transition process, we moved all of our plans, all of our carriers, all of our consumers onto healthcare.gov. And this is, for the most part, a lot of housekeeping to ensure that the policies that the board has approved can still either remain valid, or if certain ones need to be either removed entirely because there is no opportunity for that policy to exist, or to be amended in the process based on new information gleaned from this system. And so basically there are 35 committee recommendations that were approved, and most of these were approved back in 2012 and 2013. And at the top of page 2, you'll see a chart, and it basically breaks it down into those consumer assistance, or excuse me, those advisory committees that included finance and sustainability, plan certification, consumer assistance, SHOP, and then, of course, reinsurance and risk adjustment. And you'll see how the breakdown of those recommendations laid out in that first column. The recommendations moving forward of the keep as is, change, replace, and delete are recommendations from staff. And today we're going to go over the Small Business Health Options Program, or SHOP. One of the ones that we do not plan to bring back to the board is the reinsurance and risk adjustment. The recommendations that were made by that committee to the board were to defer those programs to the federal government. And we see no reason to change that policy, or unless, of course, the board would like us to revisit that. So that will be one section, unless otherwise told, will not be brought back to the board in subsequent reports in subsequent months. But the 7 SHOP recommendations that were approved by the board, of those 7, the first 4 of them, staff recommends that you really don't make any changes to at all. The principles of the first recommendation still remain the same. Markets still remain separate for that merging individual and group markets, and small group, of course, increases to 100 employees in 2016. The offering the same QHPs in the individual and shop exchanges, that appears to not need any additional change in policy. To standardize plan design cost sharing, to not impose additional requirements beyond what the Affordable Care Act requires was the recommendation, and we see no recommendation to change that. Number of QHPs offered by each carrier in a given tier. Here's where we believe we need to make the first adjustment. And that, of course, is recommendation number 5. It's actually spelled out a little bit more on page 4 for the report. But right now, the recommendation is that each licensed carrier be allowed to offer no more than 5 qualified health plans in each metal tier, which includes the catastrophic tier in each market, individual and shop. And what we are recommending is adding one piece of language to that, to add in each service area. Right now, if that policy were in effect with our current process, one of our insurance carriers or all of our insurance carriers then could only have 5 qualified health plans total in the silver tier across all four service areas, and that would immensely reduce the amount of plan offerings available to Nevadans to enroll in health insurance in the marketplace. And so for 2014 and 2015, it was understood that it was 5 per tier per service area. And so we wanted to make sure that this language was added to this policy as a housekeeping process. I can continue, Madam Chair, or we can stop and talk about each of these recommendations. I leave it to your discretion.
Since there's only 2 more, why don't you go ahead and finish?
Perfect. So the next one, recommendation 6, the employer-employee purchasing model. If you remember back in the discussions of the SHOP committee, the idea was to increase the amount of available opportunities for employers to decide how they wanted to offer plans, and that was predicated on a system that could support all of those. The recommendation, of course, is laid out in full there, but we recommend removing open shop and the package option. If you remember, open shop was any insurance plan that was available in a service area could be put in a docket or in a program that can be offered to all employees that an employer has employed, for lack of redundancy. That option is not supported by CMS's SHOP today. Similarly, the package option, where one insurance carrier could merge or marry up a qualified health plan with another qualified health plan from another insurance carrier and provide this as a package deal, that option is also not available at the federally facilitated SHOP or the SHOP that we use at healthcare.gov today. And so we are recommending there that that those be removed, that the single plan option should be included in purchasing options, because that is the exact plan that was approved when I believe Commissioner Kipper came back and we discussed the delay in the employer mandate or the employee selection. And so these changes reflect current available options on healthcare.gov, and we recommend removing just the bulk of this entire recommendation as it no longer applies. Finally, recommendation number 7. It deals with the minimum contribution and participation requirements. And again, the recommendation that was provided to the board that the board approved really goes into detail on the different types of plan offerings, those package QHPs, open metal tiers, open shop. There's a lot of language in here that if the recommendation on the above for recommendation number 6, if that gets altered, if that gets cleaned up, well, then a lot of the information in recommendation 7 needs to follow suit. But primarily, we recommend replacing the participation language with just a very simple and concise statement that qualified employers participating on the SHOP must enroll a minimum of 75% of qualified employees. And then we recommend eliminating the rest of this recommendation, as healthcare.gov cannot support either employer contribution requirements or those other plan package offerings. And with that, I'd be willing to take any questions.
Thank you, Mr. Haycock. Any questions from the board members?
Damon, this is essentially, as to the last 2 recommendations, just housekeeping to meet the requirements of healthcare.gov, right?
Damon Haycock for the record. Yes, Ms. Kerr. They are housekeeping, and the first recommendation that we believe requires adjustment, recommendation number 5, is our own internal housekeeping to adhere to the current policy and the current process that we have followed for the last 2 years.
Well, I'm not terribly excited about the lessening in options for small businesses, but if we have to do it to meet the requirements of healthcare.gov and our own internal housekeeping, then it would seem to make sense.
Ms. Kerr, I will add that this is Damon Hayes for the record, that every opportunity that we have to influence our federal partners in options and available issues, we take very seriously, and we will bring anything that the board requests or desires to our partners at the feds as they continue to build out the SHOP program, as well as any other plan certification processes as we go into those in future months.
Florence Jameson, yeah, that addressed, it sounded like 5 was already actually happening, so we're just doing housekeeping. So there's really no change there in reality, just our housekeeping for our so that it's spelled out correctly. And in 6 and 7, it sounds like we really don't have, it's not really for discussion that we actually need to do that to comply, so we just need to do that.
Mr. Haycock?
Is that correct?
Oh, I'm sorry.
Yes, Damon Haycock for the record. That is correct. Where we can have policies that allow certain things to occur, we can't enforce those policies on our federal partners. And so I don't want you to feel that you can't decide how things should be. You just can't enforce them to occur on this healthcare.gov platform.
Thank you.
Mr. Haycock, one question I have is the SHOP enrollment. Is it included in the enrollment information that was provided as part of agenda item 5? And if it's not, what was the enrollment this last time for 2015 in the SHOP?
Damon Haycock for the record. Yes, the SHOP enrollment is included in the enrollment report that Ms. Eaton has provided.
Do you happen to know how much of that was the SHOP?
Currently, we are sitting at a mighty 6 individuals.
Okay, thank you. All right. Dr. Jameson?
How are we marketing the SHOP? What type of outreach are we doing?
Bruce Gilbert for the record. Dr. Jameson, I don't know that we ever have marketed SHOP as a separate product, if you will. I think that in our interaction with agents and brokers, we have discussed the SHOP product, I know more than once. The problem with the SHOP product is a problem, and we were discussing this at the Division of Insurance earlier today. The problem is, no matter which state you look at, there's not robust enrollment in SHOP, and one of the reasons is that it simply isn't as attractive to a business to enter into the SHOP plan as it is for an individual to take advantage of the subsidies that are available for individual coverage. That's not to say that there aren't potentially tax credits that are available with respect to small and micro businesses that do go onto the SHOP, but for the most part, nationally, it's not anything that's been done well. I have reached out to the agent and broker community, and as a matter of fact, I anticipate meeting with them in May to sit down and talk specifically about SHOP and some other things in order to figure out how, assuming it is possible, that we can make that program more attractive or define a market that they may find attractive to bring to the SHOP. So as much as I would like to say we've worked on that specifically to this point, we have not, to the best of my knowledge. But that's not going to be true on an ongoing basis.
Thank you. Is a motion in order, madam?
Motion is in order.
Well, I move that we revise recommendation number 5 to incorporate in each service area at the end of that recommendation.
Okay.
Second that motion. Florence
Thank you.
Jameson.
All those in favor say aye.
Aye.
Aye. Opposed? All right, you can combine the next two if
Yes.
it's appropriate.
Just trying to figure out what that motion is.
Staff recommendation.
I move that we take the staff recommendation for recommendations number 6 and 7.
Florence Jameson, I second that motion.
Thank you. All those in favor say aye.
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 Opposed? Great. Thank you very much. All right. That brings us to number 9, which is status of Xerox closeout.
For the record, Damon Haycock, I will start this report, and Laura Rich will continue the last half of it. This will be the last report that you hear about the BOSS decommissioning process. We successfully disconnected the BOSS from the Division of Welfare and Supportive Services Healthcare Reform Eligibility Engine on April 1st. Of course, this year, this concludes this activity, so that process has now come to closure. As far as data transition and retention, we issued a request for a proposal for long-term data storage back in March. The responses were due yesterday. I did receive a response in, so we are under the evaluation process right now. The entire process, of course, followed the state of Nevada's procurement policies and completely transparent. Once or if awarded, then the vendor will be announced on the exchange's website, and we will bring that information, of course, back to the board. We have the exchange's contractor, Natoma, has successfully received a copy of the current BOSS data to use during testing of that application software that will be used to recreate plan year 2014 accounts for responses to information requests, as well as for 1095A form corrections and the IRS reporting that corresponds with it. That testing process will go through at least the remainder of this month and potentially into next month as well. As Mr. Gilbert mentioned in his director's report, the IRS conducted a review of all of our FTI. They came out here on March 31st and left on April 2nd. At the closing conference that we had with the IRS on April 2nd, the IRS informed us that they had, of course, concerns with Xerox continuing to possess the FTI. I won't regurgitate what Bruce has mentioned, but long story short, we are hoping for some final guidance tomorrow morning at our conference call that will assist us in meeting the requirements to appropriately safeguard and store federal tax information for Nevadans for plan year 2014. The issue surrounds the transition and transfer of that data. We have plans in place once it is transferred and transmitted that the IRS has already informed us will be acceptable for the appropriate storage here, either at the exchange or with a third-party vendor here locally. So we feel that there's no issue or no concern about the security of Nevadans' FTI as we will receive it and hold on to it. The concern is, does Xerox have the authority to hold on to it today? And what do we need to do to move that data to where it needs to go to its final resting place? That's basically the FTI issue in a nutshell. And again, we will have more information on it tomorrow. I'm going to now move this over to Laura Rich for the call center closeout and case resolution discussion.
Laura Rich for the record. We originally had planned to launch our Consumer Assistance Center on April 1st. But on March 16th, the exchange was informed by Xerox that in order to support Nevadans with the 1095A questions through that initial tax filing season, that they were going to remain on board until April 15th. So as a result, we changed the launch of the Exchange Consumer Assistance Center, and it was delayed until April 16th, which is tomorrow. The current Xerox call center continues to receive an average of about 180 calls a day, with approximately 1/3 of those being 1095A related calls. And based on a report that we received from Xerox showing a relatively low volume of calls being received on Saturdays, the exchange requested that Xerox discontinue Saturday hours effective immediately. Nevada Primary Care Associates, located in Carson City, will be staffing the Consumer Assistance Center with the equivalent of 5 EEFs as of April 16th, and this number will increase during the open enrollment season. In order to accommodate flexibility, vacations, sick time, things like that, the Consumer Assistance Center will staff it with 4 full-time staff, 3 part-time staff, and 3 on-call staff. And all of these EEFs are licensed, and most of them are coming in with prior experience as well. Some of them, actually most of them, about half of them are bilingual. During the first 2 weeks of April, all the staff was required to attend on-site. They received the existing EEF training, or they went through the required EEF training, and they also received further customer service and hands-on exercises that were provided by NVPCA. 3 days of supplemental preparation was provided by the exchange to include training from a tax professional on 1095 related issues, Medicaid-specific training provided by the Division of Welfare and Supportive Services, and an ACA refresher course given by the exchange staff. In order to assist with any remaining 2014 issues, Xerox has provided a plan to the exchange which outlines a process by which the exchange and Consumer Assistance Center staff will be able to utilize Xerox as a resource after April 15th, which is starting tomorrow. As far as case reconciliation and 1095A corrections, the exchange is still working with Xerox and all of the carriers on plan year 2014 consumer issues. And after a considerable amount of time and effort, there appears to be a gap between how Xerox and the carriers want to proceed and wish to resolve those inconsistencies. These efforts are further complicated by what Damon just went over, the IRS review discussed prior to this. Once the exchange receives guidance from CMS and the IRS, we will direct Xerox accordingly. And the Exchange Henderson office is still working diligently daily on resolving the known issues to the best of their abilities. As far as 1095A corrections go, I just wanted to add that we've had so far 3 rounds. On March 5th, we had 200 go out. On March 17th, 500. And then the most recent one went out on April 9th, and that included 492 1095A corrections.
And with that, that concludes our report. We'd be willing to answer any questions.
Thank you. Any questions from the board members? I had one for Mr. Haycock. Could you explain the difference between the long-term data storage need and the functionality that the exchange contractor Natoma currently has, where it says they've received a copy of the BOSS data?
Of course. Damon Haycock for the record, Madam Chair. The long-term data retention need is in accordance with the Affordable Care Act's data retention plan. It's a 10-year plan that exchanges need to maintain data. That includes PII and FTI and non-PII, everything that has to deal with eligibility and enrollment and the accounts of those individuals. For Nevada, we need to only maintain, of course, plan year 2014 data as we successfully transition to healthcare.gov and therefore receive and transmit no data for this plan year 2015. So our 10-year clock started in January, and we have the 10 years to maintain that data. That data is required to be accessible per the Affordable Care Act by consumers if they have questions or concerns about their accounts, again, as far back as that the 10-year time frame will allow. Additionally, that data may be queried by exchange staff at this coming up point when we take over complete possession of the finalized data from Xerox to perform any additional 1095A corrections. As many may know, tax season, of course, ends today, but there are the opportunities for extensions. And then there's that 3-year look-back process as well. So we anticipate, we haven't received a final guidance from the IRS, but we have heard anywhere from 3 to 4 years that we would need to continue to be able to provide corrected 1095A forms for those individuals that wish to go back and revise their taxes. And so we need to ensure that we have a software capability to not only go in and query the system and find out what occurred to assist folks in getting the information per that Affordable Care Act data retention requirement, but also to provide those critical 1095A corrections, not only for today and for this next period, but also for that 3 to 4 year look back as well. And so Natoma has been contracted to build those 2 software applications, the basically the look up and see what happened type of of application. If someone says, I believe that I should have been terminated on such and such date, I sent in a letter. The idea is that we're able to pull in all that consumer relations management or CRM tool type of data that Xerox had hopefully sent over appropriately that we can query, as well as any of the conversations that may have been recorded and any of the obligations that the Xerox call center staff had given those consumers to assist that consumer fix the problem with the carrier. And without trying to kind of overwhelm everything, I think I'll leave it at that for any additional questions.
The Natoma application data storage is not sufficient to meet the long-term need?
We did not ask Natoma to develop a long-term data storage requirement. Natoma is currently contracted with the exchange to assist in the closeout activities. And as far as the legitimacy of what we can pay them for, the creation of this software platform or these two software systems meets that requirement and was approved by our federal partners. To get into a long-term data storage requirement, we wanted to use the statewide procurement process and to do a transparent process to allow all competitors the opportunity to bid on this and provide us with this requirement. And so with that, because that's not directly tied to this exact closeout of Xerox, and it was something that all exchanges would have to do regardless, we ended up bidding it out in accordance with state procurement rules.
All right, hopefully we don't end up having to pay for the same functionality twice.
Yeah.
And Madam Chair, that is definitely not what we are attempting to do. In no way, shape, or form did we ask Natoma to recreate the BOSS so that way we could recreate data. We went for the most streamlined and efficient and costly process, or costless process, or low cost process, I think is the term I'm looking for, to ensure that we were sustainable and efficient with funding. I agree with you completely. We didn't want to repay for things twice.
All right. That brings us to item 10, which is discussion and possible action regarding dates, times, and agenda items for future meetings. Any items that the board wants to bring up for this purpose?
It would probably be covered. I would just like to a little follow through on SHOP and how it's the outreach is going, and what we are doing to see if we can cultivate that. I'm really curious nationally also why it isn't very successful. I just would have thought many small businesses would have seen this as a wonderful opportunity. I don't quite understand that.
Bruce Gilbert, for the record. One of the key differentiators, I think, between the SHOP plan and the individual market is this. To this point in time, there has been no legal requirement that employers take advantage of the SHOP plan or otherwise provide insurance to their employees, particularly those with a workforce of 50 or less. So basically what you have, unlike the individual market, where you have basically a requirement and a financial penalty in the event that people do not seek out coverage. That is not true and has not been true with respect to the bulk of the employers who would fit within the SHOP exchange. You know, it's really a very specialized exchange if you think about it. You're looking for people with under 50 employees whose average salary per employee is under $50,000. And there were a variety of other aspects that were taken into account in terms of determining whether it might prove attractive. Unfortunately, I think for a lot of reasons, primarily the fact that there is no legal requirement that you seek out this coverage, there hasn't been a lot of movement in that market. These are smaller businesses where they're counting every penny, and unless we can provide a significant reason for them to come onto the SHOP exchange and go ahead and purchase, then I think we got a tough row to hoe, to be frank with you.
Thank you.
Madam Chairman, Von Lewis, I would like to see just a continuing update on where we are with the closeout of Xerox. and, the reconciliation process.
Right. And then I think it's already on the list, but a bit of a formal debrief of the 2015 open enrollment in May or June when it's appropriate.
Madam Chair?
Yes, Dr. Jameson.
I'm not sure, will we ever really be able to see any kind of numbers on the unresolved cases 2014?
Bruce Gilbert for the record. I think that we will have the opportunity to further discuss that, whether I can give you actual numbers or not. And I know we've discussed this a number of times, and that the board is interested in trying to get its arms around the actual number of discrepancies. I'm going to call them discrepancies that appear in the data and that affect consumers, carriers, and others. There will be additional conversations in that regard. We'll be talking to Mr. Belcourt about that as well, but I can't provide those numbers at present.
We probably, no one's at liberty to say anything about why or how the class action suits were dropped, but I am just happy to hear that's the case.
Thank you, Dr. Jameson. As am I assure you.
All right, we'll open it up for public comment. Anyone in Las Vegas? Sir.
Yeah. Okay. For the record, Lucilla.
You want to come to the table so they can see you?
Sure. Not much to look at. Just Lucilla, broker here in Nevada. About the enrollment numbers and its relationship to who did the enrollment. If I did my math right, if there were 73,596 people that picked a plan, 58,000 of them paid for a plan. So there's about 20% of them that didn't pay for the plan. So in calculating the budget for navigators and all the other things, can you look at do they look at the number of the people that enrolled and see how much of it was done by the broker community versus the navigator community to either up or lower the value of the dollar put into navigators? Is it part of the calculations? I mean, it didn't seem like there was a lot of calculations.
Right. So I think in public comment we can take that. It's not really a forum to have an exchange.
Gotcha.
So we'll take that as something for staff to incorporate in next month's report.
Okay.
To the degree that they can.
Okay. Thank you.
Thank you. Any other public comment in Las Vegas? Public comment in Carson City?
None.
Thank you. All right, then we are adjourned. Thank you all.
Thank you.
Thank you.
Yeah.